Good morning, everyone, and welcome to our telephone town hall with Mayor Randall L. Woodfin. My name is Rick Journey. I serve as Director of Communications for the City of Birmingham, and I'm moderating today's call. Today, you'll be hearing from Mayor Woodfin, and we'll be opening up for questions and answers. So at any time during the call, you may press digit 7 on your keypad to have the opportunity to personally ask Mayor Woodfin a question. Our staff members are standing by to assist you. Now I'd like to welcome and turn this meeting over to Mayor Woodfin.
Good morning, everyone. This is Mayor Woodfin. I want to thank the neighborhood leaders and officers for being on this call this morning. I will attempt to be very short so we can leave the majority of our time to any questions you have. As many of you all know, we are on unprecedented times in our city and community, as well as our nation and world. And as a community, we must do our part to protect our citizens and residents in this COVID-19 coronavirus pandemic that is spreading rapidly, even just here in Jefferson County, compared to the rest of the state. And so you all come in many ways. The first is just being armed with enough knowledge and information as leaders to be able to go out here and share it with your own family members, your own circle, and your neighbors. Top 3 things, as I've stated since last week, and I'll continue to state, is one, let's practice good common sense. The best example I give of that, if anyone is sick, please stay home. Number 2, practicing good hygiene, continuing to wash your hands, using hand sanitizers and other things of that nature. And number 3, how you as neighborhood leaders interact with your residents. If we've been paying attention to what's happening worldwide, there's been a lot of conversation around the country of Italy. Italy has had a very high share in the last few days of the rapid increase of the number of people that have died from the COVID-19. As many of you all know, a lot of people can get it and bounce back, but there's a percentage of people who are not able to simply bounce back and have to either be hospitalized or put on a ventilator, or worse, it takes their life. In Italy, which is why I'm bringing them up, Italy is the oldest country as far as generation and population in Europe. And that is why they're seeing such decimation and the loss of lives versus any other place on the globe right now. We should be concerned for a couple reasons. Jefferson County has a high share of older, elderly people of higher age here in our county. Within our city limits, it's even higher. And even within how you all interact with each other, we know our neighborhood meetings have a higher share of our older and or elderly population that attends. Therefore, it's extremely important that we practice social distancing, not only in the form of how we engage at church, but even your neighborhood meetings. Therefore, many of you all know, as of now, we are postponing neighborhood meetings. We're postponing neighborhood gatherings. We're postponing neighborhood events. We're postponing neighborhood fun days. Any other meetings related to gatherings as it relates to how neighborhood associations interact with each other until the foreseeable future. I am hoping, I am wishing, I am praying, and all of the above that it will be short, but we don't know until we are more intentional about stopping this spread. In addition to that information I've just shared, many of you all are looking forward to the NUSA conference, but out of our control, that organization, through its board and their vote, has decided to postpone the 2020 NUSA conference. So, in addition to that, many of you all use our libraries, you use our park and rec centers, you use a lot of facilities, city facilities, to host your neighborhood meetings. As we're now the only public place that for the city of Birmingham, as far as use, is City Hall, and that is to conduct business as it relates to permits or business license, etc. no actual meetings. In addition to that, the CAB meeting is also postponed for the foreseeable future. And so these are the things I wanted top live for you all to know and the importance of them. It's important that we continue, based on the information I've shared with you, that you all spread the word and practice those three things of if you're sick, not going out, good hygiene, as well as social distancing. With that, I want to open it up at this point for questions, and Rick Journey and or myself guide us through this process.
Thank you, Mayor. I would like to also mention that we have with us on this call today the Deputy Director of Community Resource Services, Alice Williams. She'll be available to assist us with that as well. Just a reminder for you, if you have a question during this call, you may press 7 on your keypad to have the opportunity to ask a question to Mayor Woodfin. So we have a question coming from Nan. She's asking, how does this correlate with the business community? I do want to point out that we have additional calls later on today, but for folks who are concerned about business community right now. Actually, Nan is on the line right now.
Nan, thank you for your question. As many of you all know, the city of Birmingham declared a state of an emergency for our city. That allows us to enforce certain things if we need to. But separate from us, the Jefferson County Health Department has powers that allows them to curtail, shut down, or regulate how several businesses operate. That includes child daycare centers, that includes nursing homes, that includes retail, and within retail definitely includes bars, restaurants, etc. As many of you all know, they made a decision to stop in-dining eating for a lot of our restaurants, and they closed bars as well. Now, they did allow the exception of pickup, curbside pickup, or delivery. But as many of you all know, a lot of these small businesses are very dependent on walk-in customers. And because they don't have their walk-in customers, just last night I talked to a business owner that owns 3 small stores, and they have to lay off a collective of all combined 3 stores, 80 employees, because they're front-end hourly workers. Because of that, this employer still has to pay rent. This employer is unable to pay its employees, and this ripple that it has. So we've created an emergency small business fund from an economic development office, which will be matched by some outside private dollars that allows us to create a loan program to borrow and pay back within up to 180 days to support small business owners. But we're also working on a plan to convert those front-end workers to make sure they can remain in some form of employment as well, so all people are not out of a job. In addition to that, those employees affected by the COVID-19, we continue to have constant contact with the leadership of all our utilities, Alabama Power, Water, Spire Gas, Spectrum, AT&T. They've assured me that they are willing to work with their customers to make sure that there's no disruption to service, but advise if there are reasons that they can't pay their utility bill because of unemployment from the COVID-19, then they are to reach out and directly call customer service to one of those utility companies, and I'm confident something can be worked out. In addition to that, we are in constant contact with the Sheriff's Office, who enforces and carries out convictions. And they've also shared some information that for the next, short time, they won't be evicting people because of the coronavirus, based on people being unemployed, being laid off abruptly, all of a sudden. And then the last note is the largest group. I'm not saying that right. Let me try to say that again. The biggest housing person in the community for those hourly workers who could possibly be laid off is the Birmingham Housing Authority. And so we've also talked to the Housing Authority, and they have shared they won't be evicting anybody in the next 30 days either. And so we've in constant contact on making sure we can care for folk who have fallen on hard times because of loss of job because of the coronavirus.
Mayor, one follow-up on that I wanted to bring up. Man also asked another part of that question is what the business community can do, and I'd like to preface that with bhamstrong.com. bhamstrong.com is an opportunity where we can share information, where people can share information of how they can help as well as if they need help.
All right. I think the business community is definitely wanted to see are in a position to find a way to help some of our small business owners. A lot of them are in support of the food drives, as well as supporting some of our those in our homeless community who are susceptible to the coronavirus and making sure they get the medical attention they need. And so I think what you'll see from corporate Birmingham is financial support for not only our small businesses, but for our individuals in the community through the support of nonprofits as well.
Mayor, I would like to remind folks who are on this line, too, you can ask of neighborhood events and meetings. I think you said you've heard questions about use of city facilities, correct? You've heard people ask about that.
Yes, sir. We have a question about our neighborhood associations able to still use those facilities for meetings and things like that. We're encouraging everyone to hold off on doing that because we're trying to sanitize and clean those facilities for use and make sure all the employees and the citizens are safe. So, yes, sir.
All right, thank you. We have a question from Walladine. I believe she's asking a question about, and we can probably do this jointly in responding. If we have a senior who is sick and needs testing but is unable to travel, would there be a way for them to be tested at home? My understanding at this point is that we've been in touch. The mayor talks daily with Jefferson County Department of Health. He also stays in touch with the leadership at UAB Medical. There are some very basic things, and that's a good question. If you think you have symptoms, and this is coming from directly from Public Health today, if you think you have symptoms of the novel coronavirus, call your doctor first. Do not go to a doctor's office, and I'll get to the more detail of Willadine's question in a moment. Do not go to the doctor's office unless you need immediate care, but call them first. You don't want to risk the spread of your illness if you think you have it. Do not go to the emergency room unless you require critical immediate care. Emergency rooms need to serve those with the most critical needs. So do not go to the emergency room for COVID-19 testing. There is a national blood shortage. If you are healthy and eligible, donate blood as soon as possible. Contact the Red Cross to find out where to donate and how to schedule an appointment. And so I wanted to list those because those are key messages that the health community has asked us to share with all of you. Going to your question, Willadine, in particular, if somebody is not able...
Ms. Streeter?
Yes. Walladine, going to your question in particular about if somebody is not able to get there, there are a couple of resources we want to remind you of. 211 is one of those resources. United Way has set this up where they are coordinating to provide anything for those who are underserved. So just a reminder for you, 211 is a resource we would do. If it is a critical condition situation, they can also, and there is a critical situation, they need to call for paramedics if needed. Mr. Mayor?
Ms. Streeter, of course, as always, thank you for being a leader in your neighborhood and community, and that was a really great question. Just know, everybody, I have directly said to those in charge, we need more testing available, and we need a testing site on this side of the mountain. So just know I'm working to get an actual physical testing site in the city limits of Birmingham for those who are underserved and for those who don't have adequate transportation. I think there is another question around how will school graduations be handled. We're in constant contact with the superintendent as well, and she's in constant contact with the state superintendent. Anything related to the class of 2020 graduations has not been determined at this time, and anything that will be determined will be it will be at the leadership of the state superintendent, who then in return will share all that information with each superintendent across all the school systems. And so that's the answer to that question. So there's a question that says, look at the other big cities that have shut down their restaurants. How do we know local restaurants aren't contaminating us? That question, here's how I'm going to try to explain that question. The good news is this. Restaurants have always been regulated by our health department. I think we all know the scores and grading they receive on a monthly basis. And so the same way if a person's sick, or the same way if a person has the flu, employers are responsible for regulating employees who manage and operate food at a restaurant. That's the first thing. Second thing you all should know is the health department is now concerned about, their original concern is about social distancing, which is why they stopped allowing people to eat at restaurants inside, because we needed to practice social distancing. They're now concerned about surface touching, meaning people that touch doors or put their hand on the counter. So I think you'll see some more language, forceful language around making sure doors are open for a customer to walk in, and or making sure people don't put their hands on counters if they walk in to pick up their food. But I think everybody should feel comfortable knowing this. The regulations that are at a restaurant is very similar to the regulations that are at a grocery store or at a convenience store or a gas station. These would all be defined as essential places, meaning they would never close because people have to eat. And so they continue to be monitored and regulated by the health department. There's a question around how can we help our community food bank. That answer is very easy. Please call 211. Drew Langlow of the United Way has created a process for people who want to volunteer and support our community food bank here. So please call 211, which is a support line for those who want to volunteer and engage.
There was a question, and I think it goes to what you just asked, of are the banks still open?
A bank would be defined as essential because many people don't have direct deposits, and I have shared with the health department. The exceptions on the list are the following: grocery stores, pharmacies, gas stations, convenience stores, dollar stores, and banks. There may be some hybrid of how banks are regulated, even if it's going to be drive-through only or doors, but at this point, we would not be in agreement with any banks closing, but we would have to regulate them in a different way.
Mayor, I'd like to remind the people that are on the call right now, if you have a question, press 7 on your keypad on your phone, and you can ask a question. If you press 7 on the keypad, you will be able to ask a question. So, Mayor, you held a briefing yesterday with a number of partners. talking about a variety of areas, and I know that folks are wondering about services as it comes to basic services, police, fire, public works. Are there any changes to the services that you can address to those who may have questions?
There will be no changes to public services. Please continue to take out your trash. We will continue to pick up trash. Police officers are actively working and patrolling the streets, and 911 is still active for you to call, and if emergency rescue fire services is needed. These services will not stop. Public Works is still working as well. What we have done through the grace of council and the vote passed this 2 days ago, Tuesday, we're now in a position, and through the governor, through her executive order, expediting purchasing personal protective gear for our first responders, which include police, fire rescue, and public works, to make sure when they're out there, whether it's picking up trash or responding to a call, which is a possible COVID-19 call, they have the right personal equipment to protect themselves and to protect their colleagues as well. So basic services will continue.
Mayor, you touched on this earlier. There is a question: is there a testing site in the more urban area of the city, of the region?
No, there are only 2 testing sites in our region. One is south of Birmingham, in the, I believe, 459 area, which I believe, unfortunately, is too far for our residents. The other is west of Birmingham in Bessemer. So people need to know there are currently 2 sites. But as I stay in constant contact with the leadership of UAB Health Systems, as well as others who have resources, and the state, I continue to champion getting an additional site, and if there is one, it needs to be actually on this side of the mountain in the city limits of Birmingham.
We have a question from Myra. How are we going to regulate attending church services?
Myra, if we need to, the health department and the city of Birmingham has enforcement powers, but I don't want to do that. Ms. Myra, you should know 2 things. I had a conversation with over 60 faith leaders this past Friday, and yesterday after our press conference, I had another conference call with about 53 faith leaders. And this is what I told the faith leaders. Just like the example I gave you all about Italy, the number 1 place our elderly community congregates is nursing homes. So the federal government and the local health department have already regulated nursing homes. The second largest gathering for our seniors, our elders, and those who are older in our community is the church. I believe the last thing a pastor wants is for a large amount of his members or her members to get sick with this COVID virus and have the ability to not be able to heal themselves. And so I gave the faith leaders 3 options. Option 1, I highly suggest you not have church in a physical place, that if the option exists for you to have church online or by phone where you can record a sermon and have your members call in to listen to it, then please exercise that. Option 2, if option 1 is not available, if you have to have church, please encourage your seniors not to attend, because these are the people that are most susceptible to not only getting sick, but not being in a position to recover. Option 3, if seniors are adamant that they have to attend, then please nobody touch them. We all have social norms in the church. We like to hug, we like to kiss, we like to shake hands, we like to hold hands. But that would be not only the opposite of social distancing at this point, but the very reason why we're doing this social distancing is to not only stop this spread, but to make sure it doesn't get to our senior community. I'm depending on our faith leaders to exercise good judgment, but I'm also depending on those in the congregation to adhere to what I'm saying as well. Just like many of you all on this call, I'm a man of faith, but I understand that we're trying to save lives as well. And the last thing we want is a bunch of our seniors sitting on a pew next to each other, passing this virus to each other, not knowing that they have it, because some people don't even have symptoms.
Mayor, there is a question we've had. There is a rumor that the city will shut down. Can you respond to that?
The city would never voluntarily shut down. I can't speak to what the federal government is going to do, but I believe that's a rumor as well. We're trying to stop this curve, which is why we have enacted things, which is why the health department has enacted things like closing down eating in a restaurant, regulating retail, encouraging people to be 6 feet apart, as well as only 25 people or less in a gathering. And even when those 25 people are apart, need to be separated. If people don't adhere to that, then they're going to make us enforce some things, because we're in the middle of a health crisis. And the goal in the health crisis is to save lives. So we need people to take this serious. But today I don't see the city actually shutting down.
Mayor, there is another question about, is it safe to go out and travel to other spaces outside of the home?
Yeah, so I would encourage anybody on this phone that can hear me. If you have a bike, take a ride. If you live in walking distance of your neighborhood park, go to your neighborhood park. If you get on the swing, use some hand sanitizer before you touch it. You get off the swing, use some hand sanitizer after it. If you want to sit on the bench outside, please do. If you want to go for a run, please do. If you want to go for a walk, please do. If you need to go to the grocery store, go to the grocery store. What we're doing is saying, watch how you interact with other human beings. You're going to have to greet people differently. You may have to bow. You may have to use your foot. You may have to use your elbow. We highly encourage you not to touch people, especially if they're not your spouse or your child. So if somebody currently doesn't live in the house with you, don't touch them. If you feel you're getting sick in your house, separate yourself from other people in your house. Quarantine yourself so you don't spread it to your own family members. But yes, if you feel like getting out for a walk or a run or a bike or to the park, please do. Just watch how you interact with other people and watch what you touch. There's a question, is there any plan to eliminate public hearing from the council meeting? That's not my call. I think people on this phone know that I sit on the side during council meetings, and the reason I sit on the side is because I'm a guest just like you. The president of the council and the council regulate who gets to speak at a council meeting. The question was, are they going to suspend or be allowed or not allowed to? That is a question for the council to ask. I do know in emergency situations and based on social distancing and based on the 25 people rule, I believe they can strike a balance, but it will be up to them what that balance looks like.
Mayor, there is another question about and this may go a little bit to health department, but is the 2-week restriction period chosen as a benchmark, or will they reassess this?
Both. In ideal, it's a benchmark, but I believe people are reassessing every day.
There's another question about will we get notices from both JCDH and the City of Birmingham using the 888-777 text code. Mayor, I can talk to this a little bit if it's okay. The City of Birmingham has, through the Everbridge system, has a texting service where you can text BHM COVID, that's BHM COVID, do it in all caps, one word, to 888-777. We don't want to flood your mobile phones with lots of information, so we're very intentional about putting material out. Earlier today, we put information out about the Birmingham City Schools extended meal services. for students. That was sent out earlier today, just to remind parents when it starts at 10:30. Jefferson County also has a keyword for text messages. This includes Jefferson County Health Department and Jefferson County EMA. It is info Jeffco at 888-777. That's info Jeffco at 888-777. So we're working off of the same strategy of not putting too many messages out there, but when we see something that needs to be pushed out quickly, we're sending it out to you. If you text BHM COVID, BHM COVID to 888-777, all caps in that keyword, you will be signed in to the City of Birmingham message system, and we will send it out to you.
There's another question about if a curfew is enforced, what is the protocol for health workers, correction officers, and dialysis, cancer patients, etc., traveling to work in medical care? If any of you all have paid attention to the city of San Francisco, the entire city is on they're on some type of, I don't know, I can't find the actual term I'm looking for, but there are exceptions for people that have to get to work, for people that have to go to the grocery store, for people that have to go to their doctor's office, things of that nature. So there is protocol on with exceptions if the health department decides to keep regulating how people move in our city. There's another question about hairstylists, barbers, pedicurists, spas, etc. All of those fall under the retail lane. Any of that would be regulated by the Jefferson County Department of Health. And if they decide to restrict, then we would have to enforce.
We're looking for additional questions right now. Just to let you know, we have a few folks who have their hands raised in the system. Thank you for your patience as we move through this. We have folks that are addressing each one so we can orderly go through those questions. So stand by as we get to our next question. Here's one that I don't know if we have an immediate answer to, and Mayor, you may. Is there a place in the neighborhood to pick up gloves?
So you all should know that there, unfortunately, has been a run on gloves. There's been a run on hand sanitizer. There's been a run on Lysol. Even if a lot of us on this call disagree with some of the things that's happening at the federal level, I believe what you're about to see is very similar to World War II, a national mass production of certain critical needs. The top line critical needs are for our medical care, ventilators, hospital beds, actual gloves for those in the medical arena, as well as swabs to actually test. And so when it comes down to gloves for actual residents, we are on our own from the standpoint, if you see them at a Family Dollar or a dollar store, if you see them at a grocery store, if you see them at a Walmart, then you can buy them. But there is a shortage on that supply because the priority is for those in the medical field. I will tell you, in the actual capacity of using your hands, here is the best suggestion I can give you. Please frequently wash your hands, especially if you leave the house, or find a way to keep hand sanitizer on you, or use it at these public spaces you attend. Separate from that, all of us are very unconscious about this. We tend to touch our face. Try to be intentional about not touching your face. So, if you can't find gloves, continue to wash your hands frequently. Continue to use hand sanitizer frequently, and try to be more intentional about not touching your face.
Mayor, just want to let you know that we have just a few more minutes left in this call. Are there any final thoughts you would like to share with everybody on this call?
To the neighborhood leaders, it's pretty simple. One, as always, thank you. I know many people are afraid. I know many people are concerned. I know many people are worried about what's going to happen next. I think what we are doing is trying to over-communicate with all the residents in the city, all the stakeholder groups, and leaders. You all are leaders, so I need you to co-own everything that's been said on this phone. This is not the time for rumors. This is not the time for things that are not true. Stay informed. We will continue to send out information. Be armed with factual information so you can pass it to your neighbors on next door. You can pass it to them in text. You can pass it to them by phone. But I'll also say this too. This is the note I'll leave you on. It's very important. This is the time to show compassion. Many of you all know some of your elder seniors that can't leave the house. Do check-ins. You know, even if you don't go in the house, knock on the window in the room they're in. Let them open their blinds or curtains and just be in a position to look at them standing outside just to make sure they're okay. Give them a call, check in on them, make sure they're okay. Knock on their door and through the screen, be in a position to look at them and make sure they're okay. Just continue to show compassion. Check on your neighbors without actually coming into physical contact with them. And as always, we'll stay in contact with you, and thank you again.
Thank you,
Everyone for being here.
My apologies, we unmuted of line. Thank you everyone for being on this line. We will continue to do our very best to keep you informed of the situation, both online at birminghamal.gov/coronavirus, on our social media pages, through Everbridge and through efforts like this, in addition to our news conference and media briefings that we're doing on a fairly regular basis. Once again, thank you, and we appreciate your service to your community and supporting us at this time. Have a good day.